You're probably receiving a lot of information about your Medicare options, Medicare A, B, C, D, L, M, N, O, P. What's the difference of all of these options, right? Making sense of that is what we do here. Hello, my name is Edwin John Rodriguez, health insurance broker. I'm the owner and CEO of Insurep. We're insurance that represents you. My team and I help clients shop their individual plans based on their specific needs. Since 2007, I've had the pleasure of working with individuals and families regarding their health care coverage, with a focus mainly on Medicare. Today, we're going to talk about Medicare. We're going to have an introduction to what your options are, some important dates that you want to remember, and just a bird's eye view of explaining to you exactly what Medicare is. On today's video, we're going to discuss some basics about Medicare Part A, Medicare Part B, Medicare Part C, also known as Medicare Advantage plans, Medicare D, which is your drug coverage, and finally, your Medicare supplement option. This is going to be a light overview, just explaining some basics so you have an understanding of this information. So whenever you are close to turning 65, generally around 6 months before turning 65, you'll start receiving a lot of information in the mail from solicitors, from Medicare, from Social Security, trying to explain to you what Medicare is. They even send you a nice 2-inch thick book, and it's very difficult to make sense of that. To start, let's go ahead and discuss some basic dates that you want to make sure you remember. First, you have your annual enrollment period. This is the time of the year where you can make any change to your program. These dates are between October 15th and December 7th. No matter what option you're on related to Medicare, you can make an update to your program in that window. We also have a second enrollment period called the open enrollment period. Those dates are between January 1st and March 31st. That's the time of the year we can make one final change related to your Medicare coverage. Now, the changes you can make are only going to be related to your option 2, which we'll discuss here, specifically your Medicare Advantage plan. We also have other enrollment dates throughout the year. They're called special enrollment periods. Those dates are more related to specific scenarios, like you move or a plan is being terminated, or maybe you're coming off the employer group coverage in the middle of the year. Maybe your spouse is retired and you no longer have coverage hosted to your spouse, and now you need to enroll into your Medicare options. Those dates are more specific to the individual. We can discuss that further on a one-on-one conversation. Now we're going to talk about the basics to your Medicare. We're going to start off with Medicare Part A. Edwin, what is Medicare Part A? So Medicare Part A is your hospital coverage. So anything inpatient, think of this, anything as you're inside of the hospital, inside of a skilled nursing facility, inside of a hospice center. You're 24 hours or more, you're in an inpatient setting. That's where the Medicare Part A covers you. With Medicare Part A, you have a deductible around $1,700 for admittance for hospitalization. Whether you're there 1 day, 2 days, 10 days, 60 days, it's a deductible of $1,700. Now that covers all of your costs while you're there. Not a bad cost, right? But as you'll see with later information, there are other plans and options that will help you with these costs. As long as you work 10 years in the United States, you're going to qualify for your Medicare Part A at no cost to you. The way this is funded, you might have noticed in your paychecks during your working years that you might have seen a Medicare tax come out of your paycheck or FICA. That tax is what funds the Medicare Part A portion of your healthcare. So again, Medicare Part A is hospitalization coverage. Generally, it's going to be a deductible of $1,700 for inpatient care related to hospital care. Your Medicare Part B is going to be your medical care. Think of this as anything outpatient, anything outside of the hospital. So this would be anything literally other than being in the hospital. So doctor's visits, labs, outpatient surgeries, emergency room visits, imaging centers, your preventive care. That's going to be under the Part B portion of your coverage. Depending on your income in your prior 2 working years, in your prior 2 tax returns, your Medicare Part B premium generally is $185 per month. Now, for individuals making more than $100,000 a year, or couples filing joint making more than $200,000 a year, that Part B premium could be increased. With Medicare Part B, there is a one-time annual deductible for the year of 2025. That Part B deductible is $257. So assuming we only have regular Medicare, that red, white, and blue card, you have a deductible of $257 the first time you go see a doctor. Afterwards, Medicare then pays 80% of your healthcare, leaving you, the consumer, with a 20% balance. 20% of what? You don't know, right? 20% could be anything. Just like when you went to the grocery store last, 20% of what goes in your cart. Hey, what goes in your cart's different every time. Would you agree? We never know what that 20% amount could be. So Medicare says, hey, we're going to send you this 2-inch book. You go figure it out. You go make sense of this Medicare mess and you see what makes sense for you. So far we have your Medicare A, which is your inpatient care, hospitalization. and your Medicare B, which is your outpatient care, anything outside the hospital. If you found this information helpful so far, do me a favor and hit that like button. That's what brings us to our options. We'll consolidate the two main options. We'll call it option one, option two today on your two main options when it comes to Medicare. At this point, I'd like to ask you to take some notes. I'm going to give you very concise notes to follow, and we're going to have on a clean sheet of paper. So if you were taking notes on the dates and the basic coverages to your regular Medicare, I'd ask you to flip over your page or grab a clean sheet of paper and split this page down the middle, nice vertical line down the middle. And we're going to call the column on the left option one and the column on the right option two. I'm going to give you some notes that I'd like for you to take. I would like for your notes to match my notes, kind of like if we're sitting right next to each other, you'll be seeing how I'm explaining it to you. So that way you make sure we're catching the important parts and not writing down anything that's necessary. So again, on your notes under option one, we're going to call this Medicare supplements. These plans are also known as Medigap plans. You might have heard the term before. The terms are ubiquitous. Medicare supplements or Medigap plans. Now, right below that, let's go ahead and write down Plan G. Below Plan G, let's go ahead and write down 2 bullet points for me. The first bullet point is going to be no network. Below no network, go ahead and write down no copay. Next to no copays in parentheses, go ahead and write down $257 per year. Again, we'll make sense of this in just a moment. I just want to make sure you have your notes matching mine, and we'll circle back and explain to you more in detail what these notes are. Right below that 257, no more bullet points now. So we just have those first 2 bullet points. Right below the no copays, let's go ahead and write down all you can eat buffet in quotations. This will make sense in just a moment, I promise. All you can eat buffet. Right below that, let's go ahead and write down $100 to $200 per month. That's the estimated premium, depending on zip code, gender, tobacco status, can vary in the premium or even in your plan selection, depending on the carrier you choose. Again, we'll discuss more details shortly. So right below the premium, let's go ahead and write down add Part D separately, also known as the drug plan, RX. If you go the option one route with a supplemental plan, you do have to add drug coverage separately. Again, we'll get into more detail in just a moment. Drug plans can range between $0 and around $100 per month. Really is going to depend on your medication needs, as well as your pharmacy preferences. Last but not least, underneath that last note there, let's go ahead and write down within 6 months of your Part B effective date. So that's it for your notes. So that's option one in a nutshell. Now let's circle back and talk about exactly what that option one means to you. Option one is what we call Medicare supplement plans, also known as Medigap plan. The most popular plan my clients like to go with is Plan G, as in golf. Why is Plan G so popular with your clients? Well, Plan G says 2 main things. The first thing that Plan G says is that there's no network. You can go to any doctor as long as they accept Medicare. You don't have to worry about going into a provider directory, searching online, calling through the phone book, finding which doctors take Medicare. All you do is simply contact the doctor that's important to you and just ensure that they take Medicare. Now, secret is most doctors take Medicare, right? It's very difficult to find a doctor who doesn't take Medicare. I live here in Florida, retirement capital, very popular that doctors do take Medicare, but there are some that obviously don't take Medicare, like maybe your homeopathic doctors or chiropractic care doctors sometimes don't take Medicare. So with option one, Medicare supplement, specifically Plan G, the first bullet point is no network. The second bullet point is no copays. Going back to the beginning of the conversation, you remember when you have traditional Medicare, Medicare pays a portion of your healthcare, your differences of your deductibles, and your coinsurance you're left with. Well, with a supplemental Plan G, they actually pick up all of that for you. So in the event of a hospitalization or doctors or lab surgeries, all of that stuff, everything is covered at no copay. Medicare pays 80% of your healthcare. Your supplement plan, specifically Plan G, will come in and pick up your 20% plus deductibles, except a one-time annual Part B deductible of, want to give it a guess? $257. That's right. That's what you have written down. The $257 is what you'd be responsible for in the calendar year. Okay. So literally, I like to call this plan an all-you-can-eat buffet. Why is that, Edwin? Well, take a look at the notes, right? Once you pay your deductible of $257, you're done for the year. Medicare is covering 80% of your healthcare. Your supplemental Plan G is picking up your 20% plus your deductibles, except for that $257 once per year. So let me give an example. Edwin, what if I was in the hospital 10 days? What do I pay? Nothing. Edwin, I had to undergo chemotherapy. What do I pay? You ready? Nothing. Doctors, labs, surgeries, inpatient, outpatient procedures, hospitalizations, MRIs, CAT scans. If I didn't say that already, you name it. Everything is gobbled up related to hospital and medical services between your Medicare and your supplemental plan G. And that's why I like to call this plan an all-you-can-eat buffet. And you probably understand the analogy, right? You pay to get in the door. In this case, you pay your monthly premium, and that guarantees no network and no out-of-pocket. By going this route, depending on your zip code, gender, tobacco status, the premiums can range on these types of plans. Here in Florida, specifically in Central Florida, these plans can range anywhere between $150 to $200 a month. For my clients in the Northeast and in the Midwest, they're closer to around $100 a month for this type of plan. I'm not here to tell you what the best plan is for you. My job is to shine light on your options and help you make the best decision based on your individual needs. By going the option one route, you do have to add drug coverage separate. Drug coverage is going to be a separate portion of coverage. This is also known as Part D, as in David, or D as in drugs. It's the prescription drug coverage. It is a standalone plan. Depending on your medication needs, will determine specifically which drug plan makes the most sense for you. I have a very fancy tool, not too fancy actually, but I have a nice tool that I use that allows me to enter in your medications, the dosage, the frequency of those medications, as well as any preferred pharmacies, and we can hit run. And what happens is it brings the cream to the top, and it tell us which specific plan makes the most sense for you based on those medications and pharmacies. Last but not least, the last note you have on this option one column is no underwriting within 6 months of your Part B being activated. And what that means is whenever you first become eligible for Medicare, or when you first activate your Part B of your Medicare, there's not going to be any underwriting to go with an option one plan. Okay. If you decide later down the road, maybe you were on Medicare A and B and 10 years have gone by, or you're with an option two plan, we'll discuss more in just a moment, and you decide you want to go to an option one plan later down the road, if it's later than 6 months after becoming first eligible for your Part B of your Medicare, then you will have to go through underwriting. So as long as you enroll in option one plan, a supplemental policy, within the first 6 months of activating your Part B, then you will not have to worry about going through underwriting. So just to recap, option one is what we call Medicare supplement plans, also known as Medigap plans. The most common plan with my clients is Medicare Plan G. The reason why Plan G is popular is because there's no network. You can go to any doctor as long as they accept Medicare, and there's no out-of-pockets. There's no out-of-pocket costs, no copays. Medicare covers 80% of your healthcare, your 20% plus your deductibles. The supplement plan will come in and pick up for you. I like to call this plan an all-you-can-eat buffet because you pay your flat premium every month. It guarantees that no matter what you do with the doctor, as much as you want, as many times as you want, you can go see doctors, labs, hospital surgeries, and paying a red cent more because everything is covered between your supplement and your Medicare plan together. Again, going this route, you do add drug coverage separately. Depending on your medication needs, will determine which drug plan makes the most sense for you. That is something we'd want to shop on an annual basis as well. With the supplement plans, generally, there's no need to shop those plans unless we see significant price increases in a year, which is not too common. Most supplement plans can increase in premium on average about 2 to 5% per year. So do factor that into the conversation as well. And then last but not least, no underwriting when you first activate your Part B, as in Bravo, of your Medicare. Okay. Hopefully that information makes sense. That's nice and concise as far as the basics of your first option when it comes to Medicare. Now we're going to talk about option two. Just like the first column, what we're going to do is just have you go through and write down some bullet points specifically related to the items I'll be mentioning to you. And then we'll circle back and go into more detail to explain further what exactly it is that you have written down. Under option two, let's go ahead and write down Medicare Advantage. These plans are also known as Medicare Part C, as in Charlie. With Medicare Advantage plans, these plans come as either an HMO or PPO. Right below HMO or PPO, let's go ahead and write down zero premium. Right after zero premium, go ahead and put a little asterisk on that for me, because depending on your area, you may have access to $0 options. You may not. Again, here in Florida, very popular, these plans. So a lot of clients have access to the $0 option of these plans. We'll explain that further in a moment. Right below zero premium, just like the last column, we're going to create 2 bullet points. The first bullet point is going to be network. The second bullet point is copays. Now, no more need to write down any bullet points. Right below copays, go ahead and write down no deductible. Again, asterisks on that. Not always the case, but generally speaking, Most plans do not have a deductible. We'll discuss that further in just a moment. Right below no deductible, go ahead and write down MOOP. That stands for maximum out of pocket. MOOP. Edwin, what the heck is a MOOP? I'll explain that again in just a moment for you. Right below the MOOP, let's go ahead and write down RX is included. Right below the RX included, let's go ahead and write down dental, vision, hearing, and gym membership. And finally, on this column here, let's go ahead and write down no underwriting. All right, so we're going to circle back now and explain to you exactly what it is that you have written down. So under option 2, we have what we call Medicare Advantage plan, also known as Part C. With Medicare Advantage plans, these plans are commonly offered as either an HMO or a PPO. What's the difference? With HMO plans, generally speaking, you have a network of doctors. You want to make sure you use the network of doctors that participate with your program. With an HMO plan, generally speaking, you do require referrals to see doctors within the plan network. Okay. Versus with a PPO, you have a network as well, but you have the flexibility to go out of network if you really needed to. Although I normally tell my clients, let the buyer beware. If you go out of network, your costs do increase significantly if you go out of network. With a PPO plan, you have access to nationwide coverage, meaning you're able to go see other doctors in other cities, states, and zip codes with a PPO plan, allowing you essentially a national network of providers as long as they're participating in your plan. Again, with a PPO, you do have the option to go out of network, but if you go out of network, your costs can increase significantly, as well as your safety net. That's the max out of pocket, which we'll talk more about in just a moment. Generally speaking, these Advantage plans come as a zero premium plan. Again, depending on where you live, these plans are offered at $0. Edwin, $0. How can they offer me health insurance at $0 premium? Thanks for asking. Well, the way this works is rather than Medicare being responsible for 80% of your health care and you having to pick up a supplemental plan, the option 1 from the previous column, a supplemental plan to come in and pick up all of your deductibles, your co-insurances that Medicare doesn't cover, and having to go and buy a drug plan separately to that. Rather than that, Medicare says this: hey, private insurance companies, how about we pay you guys a set amount every month to take care of you, the client? Whether you're sick, whether you're healthy, whether you're happy, whether you're sad, whether you're traveling, whether you're staying put, doesn't matter. Medicare is funding the private insurance companies in the background a set amount every month to take care of you. Whether you're needing the coverage or not, Medicare is funding this policy for you in the background. Thus, these plans are able to offer you plans as little as $0. $0, Edwin, what's the catch? Well, the catch is 2 things. First, you got to use doctors in network. So you want to make sure the doctors that are important to you do participate with your plan. Before I continue, let me ask you this question. Have you ever had an insurance policy that's had a network? The answer is yes. I've never seen an insurance policy in my entire career that has not had a network, except the option 1. Okay, the supplemental plan. It's a beast of its own, let's call it. And the reason why I like pointing this out is because sometimes when I'm explaining these Advantage plans to clients, people say, "Oh, I don't want an insurance plan that tells me if I can go on or which doctors I can and can't see." Well, every insurance policy that I've ever worked with, whether it's the marketplace plans, group policies, individual health policies, in this case, Medicare, almost every plan out there has a network. So a network is nothing new to folks, right? I guarantee your current coverage through your employer or through your retirement benefit, or for those who are on the marketplace plans, I guarantee your program has a network associated with it. Okay. So don't fear a network. The key is making sure the doctors that are important to you participate with the plan that's important to you. Second is going to be copays. So with these plans, you do have out of pocket associated with them. So in the event of this, you pay that. You go here, you pay that. You do this, you pay that. Okay. So on most plans, the benefits are going to be exact set dollar amounts. On most benefits, you'll have an exact dollar amount as far as what you're responsible for, the consumer. With the Advantage plans, you pay copays based on the services you see. Generally speaking, it's a copay. Some benefits may have a co-insurance, which is a percentage. Copays are a set dollar amount, so you know exactly what to expect. Co-insurance is a percentage, so it's a percentage of the expense. Most of these plans have 0 deductible. What that means is, let's say day 1, you're on an Advantage plan. You go to the doctor, you go to the hospital, you have a surgery, whatever it may be, emergency room. You have no deductible to meet first. All you do is you pay your applicable copay based on the benefits related to your program, and you pay your copay based on the services you're seeking. Ever since 2014, when the Affordable Care Act was fully implemented, Insurance companies are now required to have a ceiling or a maximum as far as what you, the consumer, spent in the calendar year for healthcare coverage. This term is called the maximum out of pocket, the MOOP. Think of this number as a safety net, not a goal. I hope you never need your insurance, but God forbid you have a catastrophic year, seen a lot of doctors, having a lot of surgeries, a lot of hospital visits, or in most worst case scenarios, knock on wood, cancer, right? Where you're undergoing chemotherapy care. That would be a scenario where you probably going to hit your max out of pocket for that year. And that's a good thing to have a safety net associated with your plan. And that guarantees you're never going to spend more than whatever that maximum out of pocket is. So when you're shopping your health insurance plans, be sure to do your due diligence and making sure that you understand what your maximum out of pocket is. A lot of clients get focused in on what's a deductible, what's my deductible, when that's more smoke and mirrors, in my opinion. What's most important is your max out of pocket. You're guaranteed never to spend more than X amount of dollars in the calendar year. God forbid you have a catastrophic year. With Advantage plans as well, under option 2 column, prescription drug plans are also included. Prescription drug plans are built into the policy. So you don't have to go out and buy a separate drug plan when you go this route. It's actually included at no cost, part of the Advantage plan. Now, the prescription portion of the coverage, you'll have your applicable co-payments depending on your tier levels of your medications. Based on the specific medications, you may have separate co-payments based on the different tier levels of those prescriptions. Generally speaking, with Advantage plans, you also have additional benefits like dental, vision, hearing, gym membership, all built into the policy. Now, it's not every plan, but it is common. Many plans do have those extra benefits. You might have seen a lot of TV commercials between October and December. You see a lot of advertising and marketing going on for insurance plans or for Medicare insurance plans. And what they're highlighting in those commercials are these Advantage plans, specifically with these extra bells and whistles associated with it. I never advise my client to focus on those bells and whistles related to the Advantage plans because that's not so important, right? You can always change up the little bells and whistles related to your policy. Sometimes clients will want to focus mainly on those bells and whistles. And I say, hey, wait, hold on. The analogy I use is it's like trying to buy a house because you like the bushes. Well, you can always change the bushes, right? You want to make sure the house is what makes sense. It has the nice rooms. It has the layout that you're looking for. It's in the community that you want, right? The dental, the vision, the hearing, it's nice. It's a nice added benefit, but you don't want to focus on your purchase of your program based on those benefits. It's just an added feature. Think of it as a cherry on top. Last but not least, with these programs, there's no underwriting, meaning going back to those dates we discussed earlier in this video, October 15th to December 7th and January 1st to March 31st, you can actually make additional changes to these programs. So what is that? About 5 months out of the year, you can change this program. So if you're not happy with the plan or if there's some changes that go on in your needs or providers or whatever it may be, you can always make a change to these programs. So again, with Advantage plans, there's no underwriting associated with it. So if you wanted to go from Cigna to Humana, Humana to United, from United to Anthem to any other carrier for that matter, you can make changes without any underwriting. You don't have to worry about being healthy enough to qualify for these programs. In contrast with the supplemental plan, the option 1, you do have underwriting after you're on Medicare Part B for more than 6 months. To recap what we just explained for option 2, again, with Advantage plans, most plans do not have a deductible, meaning you're not going to have to come out a certain amount of pocket first before the plan helps you with medical or hospital care. Next is the max out of pocket. So these plans have a safety net. So because you do have copays and you're seeking services, you're paying this, you're paying that, you do have some small out of pockets as you seek care, you do have that safety net of the max out of pocket. And all that does is guarantees you're never going to spend more than that number in the calendar year. Again, think of this number as a safe. Advantage plans have prescription drug coverage included. So prescription drug plans are built into the policy. These plans also include additional items like dental, vision, hearing, gym membership, all built into the policy automatically on most programs. And last, with these types of programs, there's no underwriting associated with them. If you ever want to make a change to your program later down the road, we can do so. Going from one option 2 plan to another option 2 plan, just give myself and my team a call, and we'll be happy to help you with that consultation. Now, sometimes clients will have a third option if you have a retirement program available. So let's say you work for a large corporation like GM, or a lot of my clients from the Northeast work for the cities or states in which they reside, and they were given pension benefits when they retire. So some clients may have access to retirement benefits post 65 related to their health care. If that's the case, then we would consider that a third column, and that would be something we want to compare. Why is that important? Well, the reason why is because sometimes the job insurance or the retirement benefit might be a better fit. And if that's the case, I'm going to tell you to go that route. Okay. I'm very transparent with my clients. I'm not here to sell you any idea of one specific plan. I'm here to make sure I guide you in the correct direction to make sure that you're finding the best plan based on your specific needs. If you have group insurance available, then we'll consider that a third option, and we can discuss that more on a one-on-one setting to see if it makes sense to stay with your group insurance plan post-retirement, or if it makes sense to go the Medicare route with one of these two options we're discussing here. Hello, my name is Edwin John Rodriguez, health insurance broker. I'm the owner and CEO of Insurep. We're insurance that represents you. My team and I help clients shop their individual plans based on their specific needs. Since 2007, I've had the pleasure of working with individuals and families regarding their health care coverage, with a focus mainly on Medicare. Our help to our clients is completely free. The way we get paid is whatever insurance plan you decide to enroll with is the one that pays us for our time. The federal government standardizes the compensation we receive as brokers to ensure the conversation is free from bias. As your insurance representative, we help you manage your insurance on an annual basis. So if there's ever changes you need on your end, maybe you're moving, maybe a different plan makes more sense for you, we're here to help you with those transitions. If you need help with your health insurance, consider scheduling a call. There's a link in the description below that will give you access to our calendar, and you can pick a time and date that works for you. If you found this information helpful, hit that like button and subscribe. And that will keep you on top of all things health insurance, specifically Medicare. If you have other topics you'd like for me to discuss or want to know more information about, please leave those topics in the comment section below, and we'll be sure to get an extra video out for you.